Just the housekeeping again, I've got to go through it. There's no fire drills today, so if you hear the fire alarm, it's for real. The exits, you know where they are. The toilets, you know where they are. They're all marked. Staff in white T-shirts are here to help and also here to provide you with microphones if it comes to a Q&A during the day. Please continue to wear your security passes and mobile phones. Please keep them on, but on silent, so you can tweet, and we would very much encourage you to do so, and we'll look at your comments with interest. So let's get on to the first session today. It's called Leading Support for Those with Mental Health Issues and Learning Disabilities. And as we all know, mental health and learning disability nurses play a vital role. The Mental Health Forward Review and the Learning Disability Transforming Care Programme aim to transform the provision of care, of course. Led by Professor Jane Cummings, Chief Nursing Officer for England, this session will outline the important leadership role of nursing staff. It will reflect on the challenges ahead, as well as the work that is being done across the country. So please, will you welcome Professor Cummings. Jane.
Thank you. So, morning, everybody. Good, some smiles? Yeah, excellent. So I'm really pleased to be here this morning. It's a really important session, and for me, something that I really want to, for you and for the colleagues on the panel, to really identify the fantastic role that nurses play, particularly in the care of people with learning disability or mental health problems. And I want to start by just saying a big thank you. In my job, I spend a lot of time meeting frontline staff. I meet patients, I meet families, I meet carers, and I think the work that nurses, midwives, care staff, and in fact all of those in health and social care do is phenomenal, and that people are working under huge pressure at the moment. And so I wanted to start the session by saying, for me, thank you very much for everything that you and your colleagues do, and please take that message home to those people that were not able to join us today. So today we're going to focus, as I've said, on the importance of LD and mental health nursing and the invaluable roles that they have for improving care for people. I think I really want to push the fact that nurses and midwives, I think, should really be at the driving edge of change and improvement. I think there is a wealth of knowledge, there's a wealth of experience, and there's a huge amount of skill set that nurses can have to really drive the change that everybody wants to see. So I've said now for a while, and I will continue to say that, as we develop the SDPs, I really want to see the nursing voice in them, and I particularly want to see the nursing voice of those that work in LD and mental health services, really looking at what's important for the local population, for the people that we serve, and really driving those changes and those improvements. I'd like to welcome the panel. We've got a great panel here today, and after I've spoken, a couple of them will just say a few words, and then we really will have some question and answers. So I'll ask a couple of questions, and I really want to have this as interactive as possible. So we have, and that they can wave like this. So we've got Vicky. Vicky Stobbart is the Exec Director of Nursing and Quality at Guildford and Waverley CCG. And she's going to discuss the reality of the current challenges as well as some of the significant opportunities that lie ahead, and particularly focusing on learning disability. Claire Murdoch, who most of you will know, is the National Director for Mental Health, a nurse, which is also fabulous, and also the Chief Executive of Central and North West London NHS Foundation Trust. And she's really going to highlight the significant leadership role that nurses will play in the new mental health forward view, the plan, and the very challenging sort of ambitions that we've been set and that we are working on at the moment. Julia Hunt is the Director of Nursing at James Paget University, and she's going to talk about some of the practical issues around how learning disability nurses can really help patients in different settings. And alongside her is Carl Shaw. Carl works in my team in NHS England. He is somebody with lived experience with a learning disability, and actually is one of about 6 members of staff that we have that really help hold us to account and bring the voice of people with a learning disability into our services and what we do. And then last but not least, 2 more colleagues. Sue Hartley, again, many of you will know, Executive Director of Nursing at Birmingham and Solihull Mental Health Foundation Trust, and she's going to outline examples of how individuals with mental health issues are being supported to leave independent lives. And I'm really pleased that she's been joined by Katy Chachou, I think I've got that right, who was a patient in that trust and now works part-time for the Foundation Trust as a recovery peer support worker. So I think really, really important work there. So a little bit of background. Many of you will be aware that I'm the national sponsor for the Transforming Care programme. It's a piece of work that we've been doing for a couple of years. It's an absolutely vital component for me. It's really important. It's one of my really priority areas. And we've got a few aims that we're trying to address. One of those is to give people the opportunity to live in the setting that they feel is home. So moving people out of inpatient settings into a community. When they do need to be in hospital, being in hospital for the least amount of time as possible, and improving not only the quality of care, but the quality of life that people with a learning disability have. And it's about giving choice back to people. So when they're not being told what to do, where to go, how to live, they're given an opportunity to live in a way that they want to live and to be supported to do that. As well as we're looking at that, we're also looking at the wider physical and mental health problems of people with learning disability. We know that on average, people with learning disability can die up to 15 to 20 years earlier than people without. Many of those deaths are avoidable, and we've got a big programme of looking at mortality reviews, understanding that, learning lessons from it, and trying to improve the work that we do around that. We're also doing some work on reducing over-medication, and I'll talk a little bit more about that in a moment. I wanted to give you just one example. There was a guy that has got moderate learning disability and has behaviour that can challenge others. I don't like it when people say somebody's got challenging behaviour, because it's like a label. But there is something, so some people may have some behaviour that challenges other people and may need more support. So James is 58. He was originally from the North Somerset area, but he was admitted to a hospital in Cardiff where he was an inpatient for many years. And he wanted to go home, and as part of the Transforming Care programme, the local CCG was able to access some of the funding that we've made available. They've actually bought a bungalow, they've designed it, they've developed it with his input. He's been discharged, he's now living in a community setting, and he is thriving. He's able to do things that he wants to do, he's now more independent, he can make his own breakfast, he makes his own drinks when he wants them, not when somebody tells him he can have them. And it's just a really good example of how listening to what somebody wants and providing those services actually enables people to live a much more independent life and to look after and to take interest in the things that they are interested in. So the other thing I wanted to mention around LD nurses is the work that we're doing with MenCap. MenCap is providing significant support to us around access to annual health checks. Annual health checks are absolutely critical. People with a learning disability should see their GP, have an annual health check every year. They should be on a register so that people know they've got a learning disability. They can have access to the flu jab, for example. And so with MenCap's work, we've got something called the Don't Miss Out campaign, which includes easy read information and easy read letters that people can take to their GP to say, don't forget about me, and can I have my annual health check? So really, really important. And it's LD nurses that are showcasing that. The Mental Health 5-year forward view, really, really important piece of work. I'm not going to spend a lot of time talking about the detail of that because Claire will cover it when she speaks shortly. But it's suffice to say that there is a massive amount of work going on at the moment and a real focus on improving access to mental health services. And it's needed. It's absolutely desperately needed. And one of the things that is, again, one of our national priorities for NHS England. We're particularly focusing as part of that through the maternity transformation programme on the mental health, perinatal mental health. And there's a session around better births, the maternity programme later today. But as part of that, we've got a big work stream looking at perinatal mental health and actually supporting women to cope with any problems they get post-delivery, post-birth. None of you would expect me to stand here, I would imagine, and not mention leading change, adding value. I don't know how many of you know about it. I recognise quite a lot of faces in the room, but for those of you that aren't nurses or don't know about it, this is the strategy that I launched, or framework, I should say, that I launched in May last year. The purpose of this is about the role that nurses, midwives, and care staff can have in doing what it says on the tin, really leading that change, adding a huge amount of value to the work that we do, and reducing variation. We all know that if you look at the service whatever service you look at, there is enormous amounts of variation in that. So by reducing that variation and improving outcomes, improving experience, and reducing costs, we help to deliver the triple aim that sits behind the 5-year forward view. The focus of this has been really important. There's a really good example about that would be one of the pieces of work is around the variation in smoking rates. So nationally, about 15.5% of adults smoke, which is quite a scary number, really, when you think about it, when you think about the damage it does. But if you look at people with a mental health illness, about 40% of people with a serious mental health illness smoke, and that goes up to about 70% for those that are inpatients. So a huge issue there, and the role that nurses are playing, mental health nurses are playing across the country in really helping to support people to stop smoking, to look at different activities, to look at different ways of reducing reliance on smoking is absolutely critical. So, and we are getting examples of that, and we're putting the information onto our Leading Change, Adding Value website. Another area we're working on, and nurses are really helping to drive this with our pharmacy colleagues, is around STOMP. So STOMP is something which is called stop over-medication of people with learning disability or autism. And we know that every day there's about 35,000 people with a learning disability that are being prescribed antipsychotic medication, and they haven't got a diagnosis of mental health issues. So and the impact that type of medication can have on people is phenomenal. So we're driving that. We're absolutely committed to reducing it. We've got about 100 social care organisations signed up, and we've got a UK-wide learning package that's been designed with the Royal Pharmaceutical Society, and we're rolling that programme out. So again, real request from me, if you're out there, get onto it and make sure that your local services are really driving that and we stop over-medicating people. So, we've got, I mentioned just now, we've got a website. So one of the things that we want to do now, and this is a plea, very happy for people to go out there and do this. Real plea for nurses and midwives and care staff, whoever they are, to really tell us their stories about what they're doing to improve care. And we can put it on our website, and we can start to circulate it, and we can get people all over the country to share and learn from best practice. We are not very good at doing that in the NHS. We're great at doing our own little programs, and we're not very good at sharing and learning from others. And if any of you have got time, look on your brochures. Later, there's a session in the pop-up university around leading change, adding value. So leadership on the front line, I think, is really, really critical. Learning disability mental health nurses are absolutely fundamental. And one of the great privileges of my job is I go out and about and I'm able to see people on the front line. And there are lots of really good, innovative work that's going on. So Worcestershire Royal Hospital is a trust that many of you will know, has had quite a lot of negative publicity. They've had some really critical CQC reports. But they are doing a significant amount of work with a specialist LD nurse assigned to people that are admitted to that acute hospital. And they are driving improvements in care pathways and improving care in that acute setting. And they've just published a video which actually shows what they've done. And this year, I think, has seen a number of absolutely devastating events. And I just wanted to call out the guy on the right there, who's Ian Soranzo. He works as a nurse in Clare's Trust, actually. And he lives and works in the area surrounding Grenfell, the Grenfell Tower. The day of the fire, he actually went to the site. He went to the site before going to work. He looked for his patients that he knew were living in that area or living in the tower. He also went to A&E, and he went to find them, and he pulled his patients out of A&Es, and he has been providing support He's helped to coordinate the Trust's response, and he has provided a phenomenal amount of support to the people that he not only lives with or lives around, but also cares for around in Grenfell. So this is a mental health nurse that has gone over and above what you would expect. He's done an absolutely brilliant job, and I wanted to use this as an opportunity to highlight what he's done and how good that impact has been. And in addition, the trust that Claire runs have just created the Grenfell Tower Trauma Service. They've got about 50 vacancies that they're advertising to bring people in to provide ongoing support to people that have been through that terrible trauma. So it's examples like that that really demonstrate where innovation is and and how good people can be when they're given the space and the time and the opportunity to do things. So moving on rapidly, I just wanted to talk a little bit about how we position the work we do in England internationally. This is a picture of Lynn Wygans, who's the Regional Chief Nurse in Midlands and East. And earlier this year, she went to Barcelona, and she presented on leading change, adding value to the International Council of Nurses. And alongside that, I'm also working with Lord Nigel Crisp around a global nursing campaign called Nursing Now. And that's really about how we position nurses as leaders, how we look at the impact, the research and impact of nursing on outcomes and economic outcomes in particular. And we really encourage the use of things like social media to network internationally to show what we do. The NHS is incredibly well thought of, and we know that we are leading the way in many things. And it's about time that I think the image of what we do, we really stand up, we talk about it, we learn from where we need to learn from, we improve where we need to improve, but we really showcase the work that we're doing. Last month, the Department of Health and Health Education England published a mental health workforce action plan. We do need to employ a significant number of extra people. There will be a challenge in that, as all of you will be aware. But I was also really delighted that in the Next Steps document, we identified that we were going to run a postgraduate programme for nurses. We called it Nurse First, so it's like NHS Nurse First. And I'm really, really pleased to say that we've now done it. It's only 40, but 40 is more than nothing. We have got 40 students that have been appointed, and we've got 3 universities, that are going to do that. So in the north of England, we've got Edge Hill University. In London, we've got King's College. And then we've got the University of Hertfordshire that are going to be training students both for Midlands and East and also for the south of the country. Those 40 will be fast-tracked through a postgraduate programme. They will have access, they will come out with master's degrees, they are supported by trusts and STPs, and they will be fast-tracked into leadership positions. Really, really excited to do that, and Claire's Trust is one of the trusts that is picking those up. And I am absolutely delighted that those have been confirmed, and we will continue to work with them. So before I hand over to Claire, I just wanted to say that I really do believe there's never been a better time to be a nurse working in mental health or learning disability. Absolutely critical time. There are so many good things that people can do and such an impact that nursing can have, and there's just a few of those listed up there. It is an absolutely phenomenal time for people to really step up and take the lead in what is such a critical part of care. Nurses are creative, they're innovators, they're leaders, and they can really drive that change that we all want to see. So thank you very much for listening. I'm now going to hand over to Claire, who's going to talk you through the mental health forward view.
Lovely. Thank you. Thank you. Good morning, everybody. And thank you, Jane, for that. And apologies to those of you who may have heard me speak before, both about the 5-year forward view and possibly about nursing. I did say when I was asked to speak at this session in particular, it always feels a bit like coming home for me. Still a registered mental health nurse of some 33 years now. I feel privileged to have been part of an absolute quiet and steady revolution in mental health care. and to have played a part, I think, at each stage of my career, from the old Victorian asylum through to where we are today, along with so many other nurses across the country. And I want to really talk about the opportunities to continue that revolution, that quiet revolution in transforming mental health care, which mental health nurses, and in fact not only mental health nurses, nurses of all flavours, can contribute to. Now I've got one slide, only one slide, and many of you will have seen this several times before, you'll see it many times in the future. It's the 5-year forward view programme, and I am going to keep putting this slide up all the way to 2021 because it's a sort of very brief summary of some of the main headlines of what we've committed to deliver during this period. It's not the whole programme. There are things that aren't on this one slide, but this is what we'll be held to account for. Essentially, the programme intends to see 1 million extra people in evidence-based mental health services by the end of the period. And I just want to say, there's not time, I've only got 8 minutes, so I'm just going to talk to a few of these developments and where I see nurses leading the way. And then I want to say a little bit about mental health nursing more generally. Just before I highlight a few areas where I think nurses can make a difference in the delivery of the 5-year forward view, I do just want to emphasise that the 5-year forward view and the priorities of the 5-year forward view for mental health are built on a core. They're built on a set of services that already exist. Those services are developing, they need to change, they need to transform, and they are. But, for example, our community mental health teams, our acute inpatient wards, are core, are key, they're a bedrock to delivering great mental health care. So because they're not mentioned here doesn't mean they're not important. This is the next leg of what needs to be developed. Anyway, so we've said we'll see 1 million extra people by the end of the period, and I want to talk about children's services. We've said that we'll see 70,000 more children and young people. That's with specialist eating disorder services in the community, with more evidence-based interventions, intervening earlier in the pathway of illness or distress, to fundamentally change the outcomes for people's lives so that we don't create, as it were, unwittingly, long-term patients for the future. And nurses are leading community mental health teams for children and young people. They're playing a key role in the eating disorder services that we've set up nationally, working along psychologists and doctors. And because community eating disorder services for children and young people largely didn't exist until this last year, they did in little pockets, but now we have a layer of evidence-based eating disorders services across the country for children and young people. It seems to me that nurses are both leading many of those teams, but also breaking new ground in how you work alongside families, the young people themselves, and deliver evidence-based care in completely different settings, working with schools in particular, and GPs, and paediatricians. So nurses are invaluable in that space. The crisis and urgent care pathway in mental health is under real pressure. Some areas in the country have got this, I wouldn't say cracked, but they really have. Bradford, for example, and I could name others, Sheffield, have done great work looking at how we stop this pressure of beds overspilling into the private sector, long waits in A&E, real pressure in the system. And I've got to say that nurses have led much of that work. So they've really redesigned the care pathway, whether it's through the development of intensive home treatment teams, the establishment of the psychiatric liaison teams in A&E and acute hospitals more widely. And they're going to play a fundamental part in bringing an end to inappropriate out-of-area placements. This is the overspill into the private sector, by delivering a range of evidence-based interventions in the home, in A&E, in police cells, on the streets, in street triage. Go to Birmingham and see some of the great work your nurses are doing alongside the police there, where the numbers of Section 136s have tailed off dramatically, where outcomes for people in distress are much better. It's nurses in those roles. We've said that we will undertake a quarter of a million physical health checks in an evidence-based way. Largely, not exclusively, it will be nurses undertaking the full suite of physical health checks. Some of us have had to brush up our physical health care skills. I'm not going to talk about the good old days. There's no such thing. There are the old days, and there's now, and there's the future. And nurses have played a massive role in all areas. However, when I trained as a nurse, our physical health care training was pretty rigorous. And you absolutely never took a patient into your care without doing a full suite of physical health checks. That got lost, and now we're resurrecting it. And it's largely nurses that are undertaking both those assessments with patients about lifestyle, risks to health, smoking, sedentary loneliness, things that really diet, that can really affect your lifestyle, and nurses are leading this. We've got big sequins across the country, and we're seeing a huge increase in patients who are getting better, or service users who are getting better physical health care. I think the last thing I want to do, because I really want to talk you through the whole programme, and I know I can't, but I know I'm being told don't you dare by Jane, is we're also reshaping, coming back to children. We're fundamentally intending to reshape the nature of care. So we are opening some more specialist tier 4 beds because we know there's been pressure in the south and London in particular. So we are doing that. But we intend to, as soon as we can, invest money in tier 4 beds in the community services that I talked about earlier, but not only community eating disorder services for children, respite, crisis houses, a fundamental home treatment team, a fundamental shift in the care of children, and young people, and I promise you, nurses will be leading the way there as well. So that's just a kind of little flavour of what nurses are doing around the 5-year forward view for mental health. Just before I finish, I just want to say a few things about mental health nursing. We're going to be recruiting to more mental health nursing posts to care for an extra 1 million people by 2021. And we know that we've seen more nurses leaving the profession in recent times, and we know recruiting to the additional posts is going to be a real challenge. Jane has talked about some of what we're going to be doing to achieve that, however. It seems to me, quite honestly, there has never been a better time to be a mental health nurses. And for any mental health nurses or those leading teams where nurses are, I want to say this to you. We need to become really vocal about what our skills are. Our skills of assessment, review, of complex working in networks of care. We need to become the experts in co-production and working alongside service users in their own care. We need never to come up with a care plan, that hasn't been produced at least in partnership, even at times of great crisis. We need to become the experts in that space. Housing, debt, employment, the physical health care. These are the domains of mental health nurses. When I qualified, you could be a CPN, work in a day hospital or work in acute ward. That was 100 years ago, I grant you. Now you can work with new mums planning a family. You can work with children in the ways I've said. You can be in the triage cars out with the blue light with the police. The opportunities for mental health nurses have never been greater, and I'm calling on you all to step forward and step up. I've got to just quote Florence Nightingale before I stop. She said, "Rather 10 times die in the surf, heralding the way to a new world, than stand idly on the shore." Mental health nurses, your time have come. You need to be leading teams, systems of care, directors of nursing for the future. My job, your job. So on that note, I leave you. Thank you very much for listening to me.
Thank you, Claire. So, hand over to Vicky.
Thank you very much, and good morning, everybody. As a learning disability nurse, I'm absolutely delighted to be invited by Professor Jane Cummings to share with you my thoughts about how learning disability nursing is transforming care. Learning disability nurses promote health, well-being and independence, and much more than that, they see the person for who they want to be. I'm going to start by giving you a very brief background to my career. I'll then share with you my perspective about the unique skills, knowledge and expertise that learning disability nurses have. And I'll give you an example from the area that I currently work in, which is Surrey. And then I'll finish by looking at opportunities that lie ahead and questions that you may want to take back to your area. So this is just a little collage of my career. I registered as a learning disability nurse in 1993, and for me it was the start of a lifelong interest and commitment to support people with learning disabilities. I've loved every minute of my career, and still today I still have the same passion and drive to improve and empower. The start for me on my journey was the moment that I stepped foot into a long-stay institution in 1991, and I was on placement there as a 19-year-old, and I saw for the first time how some people with learning disabilities were living, and I immediately thought, what can I do? What's my contribution? And what change can I make for the better? And from that moment on, I changed from the adult branch of nursing to learning disabilities, and I've never really looked back. What drives me is a strong sense of responsibility in making a difference at individual level, and now as an executive director in a CCG with a lead for commissioning CAMS, adult mental health, learning disabilities, lead for safeguarding adults and children, and also for complex children. My leadership really is to influence and steer and to get great outcomes for people. And key to all of this is really working alongside families and carers, as well as making sure that staff within the system are motivated and well supported. I've had a really diverse career across different settings, and this is a real theme for learning disability nurses. We're quite bold, and we're not afraid to be creative and try new things and be left-field thinkers. A potted history of the settings that I've worked in over the last few years is I've worked in, over the last 24 years, a school setting. I've been a community nurse for people with learning disabilities. I went into nurse leadership and management so that I could affect change. I've been a visiting lecturer at university. A real theme is working with integration and developing integrated services. And I've actually been employed by a council for 7 years. So when I managed integrated services in London, I moved into being employed by a council. I've been a safeguarding designated nurse, and now I'm an executive director, and I've been in that role since 2013. And quality improvement and wider systems leadership has really been a theme of my career. And every single day I still ask the question, how can I empower people within the system that I work to better support and improve lives? It's a really fundamental question that takes me right back to when I started my nurse training in 1990. I believe that the skills I use today as an exec director are really grounded in everything that I learnt as a learning disability nurse. So I have a really strong awareness of using power in a respectful way. Collaborations and partnerships are everything. And always don't accept that there's not a solution to a problem. Motivate and boost people. It can be really tough out there. So every area has learning disability nurses, and they work in a variety of settings across health and social care, and they make a significant difference to transforming the lives of those they support. Often they're quite an untapped resource, both for the individual, but also for population health. And sometimes my experience over my career is that learning disability nurse is not often as high profile as other areas. And Helen Laverty kind of coined it by saying they're not yet featured on Holby City or Casualty. Will we have made it when we do see that? Who knows? Don't underestimate their impact and the value that they can have in supporting people with learning disabilities to reach their potential and their ambition to live their life how they really want to. I think learning disability nurses really get partnership working and collaboration. And every day in my career now, I look back to my days as a community nurse, working with families, multidisciplinary teams, and the real importance of relationships and rapport with people. It's at the centre of everything we do. Trust is absolutely key, as is the depth of the relationships that you develop. And this can be translated through to support people. And what I've found is it's small things that really make a difference. So whether I'm strategically commissioning or whether it's through an interaction with somebody, making it personal, you really can't go wrong. This slide is taken from the Strengthening the Commitment, Modernising Learning Disability Nursing 2012. And I think for all of the learning disability nurses that I've ever met, values are really, really central to what they do. This branch of nursing works at individual level and also population level. And there's quite a few nurses now in strategic roles, and some colleagues out there in the audience I'm delighted to see. I believe that curiosity in how things interrelate and creative thinking often leads people into these positions. Learning disability nurses work across organisational boundaries, so across acute, primary care, specialist, and we'll hopefully hear some of that from panel members. Central to the role is around effectively identifying and meeting needs, promoting health outcomes. There's a lifetime continuum of facilitating choice and control, and I could go on, but I think the key thing that I would want to say is that strong partnership ethos is in everything that learning disability nurses do. And it's a really deep understanding that when power is shared, it can transform care. I've been very fortunate to be the SRO in Surrey for Transforming Care for a year now, and that's a role that's jointly shared with the AD for Adult Social Care in Surrey. And our community learning disability teams work very closely with our intensive support team, which is a newly commissioned service as a result of closing 12 assessment and treatment beds. The team, which are multi-professional, are working with people in crisis in the community to prevent hospital admission, and they're understanding why someone may challenge, and they're supporting them to have a good quality of life in the community. May not reduce the challenge, but the impact is reduced. And what we've seen over the last year is that there has been a reduced need for inpatient beds, and we've had so many positive comments from people who use services and also from family members. I just want to give you a very brief example from Surrey about a man called Josh, who's 20 years old, and he has a host of complex health issues. He has moderate learning disability, cystic fibrosis, diabetes, scoliosis, and it's known that his health will deteriorate as he gets older. Josh was adamant that he wanted to have his own home, and a key to this was somewhere where he wouldn't have to move out of when his health worsened, as there'd been a pattern of this, about him being settled where he was and then having to move when his health status changed. The community nurse worked closely with him, his family, his social worker and others, and through a detailed understanding of his health needs, through person-centred and a nursing healthcare plan, worked with the provider to ensure that they could be confident that they could meet his long-term needs. A few months ago, I'm really delighted to say that he moved into a supported living setting, which he wanted, and the community nurse provided education to the team supporting him and around his related health needs, and with ongoing support to pick up the phone if that's what was needed. And I think this is a real theme around the long-term relationship that learning disability nurses often have with people that they're supporting. The providers and Josh are confident that they can refer back to the Learning Disability Nursing Service in future if they need to. And the great thing was that the family wrote to the trust to say that the work was amazing, had changed their lives, and the nurse was made Employee of the Month by the trust. Had he not been assessed by a community nurse, he would have ended up in a nursing home more than likely. And the latest update, which I got before I travelled here, was that he's now visiting his girlfriend on the other side of Surrey, which is a very long way if you know Surrey. He is part of his community, he goes food shopping, he cooks for himself, and he goes to hospital appointments on public transport, and he visits his parents. The key is that through skilled knowledge and creativity and persistence of the community nurse working closely in partnership, she really took the time to understand what he wanted. And he's now just living his life. And from my point of view, what could be more fulfilling as a career? So I'd like to finish, because I know time is short, by just saying that, just really to plug, learning disability nurses are the only professional group specifically trained to work with people with learning disabilities. And this level of preparation currently provided at a degree level, alongside the breadth and competence and knowledge they develop, makes them a unique and critical component of the delivery of comprehensive skills. They have the ideal skill set to transform care. There is an ambitious reality. They do understand the constraints, but also have a way of getting the best outcomes from resources that we have, because often the outcomes don't cost money. These are often the best solutions. This comes from a can-do approach, and the core function is about dissolving barriers and not being afraid to have difficult conversations and making what might seem impossible possible. So I'd like to close by just saying that I hope this has given you some insight, and I could talk all day, but I'm trying to summarise. I'm sorry if I've gone over, Jane. My gentle challenge to you is to understand where learning disability nurses are working in your area, and more importantly, to understand the impact that they're making to the system and how they could contribute to a greater degree. Learning disabilities nurses are really keen to share their skills with others, and so recognising this and their contribution, do give them the opportunity to support you and what you're doing locally to making a difference to people's lives. Thank you for listening.
Thanks, Vicky. Thank you to Claire and Vicky for really giving, I think, from the heart what it's like to be a mental health or LD nurse, and also what the opportunities are. So I'm really conscious of time, and I know we did start a bit late. I think it's always difficult getting everybody in for the first session of the day. But I want to just go back to the panel, and I've got a couple of questions that we've asked people what they would like to know, and I think if we can, we'll have time. We'll open it up to you as well. So Julia, could you kick us off really? And I'm really interested in understanding a little bit about what you've done in James Paget Hospital. Can you just talk through some of the challenges and how nurses have really made an impact?
I think one of the key things for us is we have a fantastic acute learning disabilities liaison nurse, and recognising the massive contribution that she's made to the services that we deliver. But building upon her excellent work, we have now integrated learning disability nurses into our general nursing establishment. We're an acute district hospital, and what we recognise is that very specific skill set that learning disabilities nurses brings can just improve our overall care that we deliver to patients, much more patient-centred, advocates, sharing those skills, and we recognise that as an absolute asset. And some of the challenges that we are facing, and why it's important to upskill our workforce more than just the routine training and education of staff, is influence that skill mix within your staff group, is to meet the increasing challenges in the community, because we've found that people that access our services in the acute setting are often those that are hitting transitional phases in their life. Quite often adolescents unfortunately present themselves in our emergency department having experienced some breakdown in their support in the community. Well, now staff, because they have an increased awareness of the transforming agenda, working with the acute liaison nurse and community services, can much more focus upon what those patients need to support them, get the right help in place. Perhaps they are the people that are actually requesting those community educational treatment reviews, being much more proactive in doing the right thing for patients and making sure that all staff groups are working truly in the true essence of best interest, not just saying they know what's best for a patient, but actually involving patients, carers, IMCAs in doing the right things for those that access our service.
Thank you. And so we all heard Claire talk about mental health nurses really driving the change that we need to see with the forward view. Can you just talk a little bit about what you've done in your organisation, how you've helped people get the independence back, and how you think nurses should really step up and do things to improve?
Yeah, thank you. I suppose I have a short confession to make. I'm in my 35th year of working in the NHS as a nurse, and I am so proud to be a nurse. But I'm not a mental health nurse, and I so wish I was. Because I absolutely echo what you've said. This is the time for mental health nursing. I am so proud to be leading a mental health organisation and wish to continue for the longevity of my career in pursuit of perfection for mental health nursing and for the outcome of our service users. It is absolutely the right time for nursing and for mental health nursing. In our organisation, we are, I guess, really fortunate because we cover Birmingham and Solihull, so a very large population base that is hugely diverse, and there is really not a service that we don't provide. So in terms of the challenges around the 5-year forward view, we meet the needs of all of those. Nursing is absolutely instrumental, and our service users, our carers, our commissioners ask nurses to be pivotal in that role. And that, going back to the 60s, it requires courage, commitment, all of those things. And if you start at the grassroots level, you know, the work that we've done, and Katy has her own story around putting recovery, real recovery, at the focus of everything that we do, putting the person at the centre and allowing that expertise of the mental health nurse, and I don't mean care coordination because I think it's an ugly word, to really support that individual in gaining the skill set around them, whether it's a medical intervention, whether it's a peer recovery worker, whether it's the skills of the mental health nurse around their care planning, their crisis management, their risk assessments. But actually it's nursing that are pivotal to that. And I see that every month. I do one shift at least a month across our organisation, and I see that every day. You know, at a more strategic level, I've got a senior nurse in the audience here who's part of our test bed zone, who's working on an urgent care model around information sharing and diverting a crisis for individuals. That nursing has been critical in that, in informing, you know, the innovation in the way forward. Again, at a more strategic level, one of our clinical directors is a nurse, which is fantastic. Linda Playford, who is clinical director for our older adults and specialty service, and she works tirelessly across the SDB, particularly around the dementia agenda. You know, and again, is very well regarded. And I guess you know, here am I today championing the role of mental, and will continue to do so, and have just had the fortunate opportunity of being invited by the Indian Society of Psychiatrists to present at their annual conference next year on the role and function of nursing in mental health. For those that you are not aware, that nursing is less strong in those communities, and actually they're beginning to think about the role. So now, you know, now is the time, and we have to grab this and really, really do what is right for the population, and equally important, what is right for the profession.
Thank you, Sue. Carl, I'm really pleased that you've been able to join the panel. Can you just talk a little bit about how learning disability nurses have helped you, and also what it's been like working with us and what you've been doing with us?
Okay, yeah, thank you for your question, Jane. If I can, I'd like to talk a bit about my journey as a person with a mild learning disability. I remember from a young age going to like a building where people asked me questions, and I went through an exercise of like someone visiting a shop, and through that they kind of saw what I was able to do. And I remember being told that, yes, I've got a learning disability, and I was told that I would never have friends, a social life, I wouldn't have a job, I wouldn't go on holiday, I wouldn't have all these things the average person have. And as a child, that really sunk in for me. And so I remember my parents telling me stories, I don't exactly remember, but that I was very shy, I couldn't do basic tasks. So my parents told me that when I was at school, I'd always be the kid at the middle of the playground, not interacting with anybody. Sometimes my parents would ask, do you want to help me dad clean the car? And I'd say, no, I've got a learning disability, I can't do it. But one thing that stuck in my mind is, my mum said, well, you're kind of using that as an excuse a bit. So after she said that, I started to think, well, actually, if I try and do things, I'll see how I get on, and that actually worked. I got quite independent. And the other part of my life, after I left school, I felt like I did really well at school. I got 5 GCSEs. Yeah, it were grades like C's and D's, but to me I passed. I was quite glad about that. But I remember quite struggling at work because I didn't really know what I wanted to do at work. And I went to learn health and social care level 2 because people said I had a caring nature, and so everybody said I'd be really good like in a support role or working with the elderly. So I did, and in those roles I did struggle a bit. People started to notice I needed support, but even then I went through several different jobs, and my auntie at the time was learning to be a learning disability nurse herself. My nan was a carer in the community for people with learning disabilities, and they actually gave me some good advice. They actually said, yes, you have a mild learning disability, but if you just have patience and learn those things. So those things really meant a lot to me as a person. So and now I have my own car, I have my own flat, I don't get support, I've been on a holiday with friends, and I feel like I'm living a good life. And in NHS England, well, actually, talking before I got my role at NHS England, I worked for a community care provider for a company called Dimensions, and I was a quality auditor, which involved going to people with learning disabilities homes and checking if they got a good service, if they were getting good support. And I did that for 8 years. So I really got to see what good and bad support looked like. And now I'm in the role as a learning disability advisor. I've been employed nearly 2 years, 2 years next month. And some of the things I'm involved in, there's several different work streams happening. So there's, like Jane says, there's STOMP, which is stopping over medicating people with learning disabilities, autism above. There's another piece of work called Ask, Listen, Do, which is about concerns and complaints, improving systems, making it easier for people. And unfortunately, my colleague Gavin can't be here today, and I have another colleague, David Gill, and we're all learning disability and autism advisors. And we all advise on specific work streams, like the two I've just mentioned, STOMP, Ask, Listen, Do. I co-lead on these projects. So I feel like really empowered to have my say, and I have a big influence. So in terms of learning disability nurses, during the early stages of my life, I didn't have a lot to do with learning disability nurses, but through my role with NHS England, particularly with STOMP, the other medication work, I've sort of learned that learning disability, you guys have a lot of importance with regards to that, because it may be the doctors or the psychiatrists who prescribe medication, but I think when you're learning, you have a real drive to say, well, actually, why are you saying these things? And I think that's so important. So, and then my auntie, being a learning disability nurse, she really helped me with my confidence. She really helped me to think, well, yeah, you are a person with learning disability, but you bring key experience. You've lived this life. So yeah, that's why I say learning disability nurses, you all have a key role. And just thinking about my auntie, she really helped me gaining confidence. So yeah.
Thank you, Carl. Thank you very much. That was really good. And so, Katy, you've not only have you had sort of personal experiences and been cared for within Sue's Trust, but you also now work as a peer support worker and actually support other people that are struggling or have had mental health issues. Can you just talk a little bit about what's been important for you, how nurses have helped you, but also how others could replicate the model, and if you think it's a good way of working?
Yeah, so I started volunteering with the Trust about 2.5 years ago. My history is in perinatal mental health. I suffered from postpartum psychosis after my daughter was born, and I was sectioned when she was just 9 days old. And this led to being on the mother and baby unit in Birmingham for about 6 months. And then and I also developed bipolar disorder as well. I started volunteering because I wanted to give something back, because I felt that the mother and baby unit had done a lot for me. I'm also a qualified nail technician, so I decided that I wanted to come onto the unit and offer manicures or pedicures to the mums. And I do 2 evenings a month. It's very informal. It's a very relaxed setting. Can just have a nice chat with the mums, not always talking about their mental health, but, you know, being able to talk about things like medication or settling into the unit or discharge and what it's like to live back in the community. But I'd say the main thing that I can offer is hope. It's, you know, so vital. And often when I say to them, you know, I was here 5 years ago, they really can't believe it. So I did that voluntary for 2 years, and the unit now do pay me for that because they recognise my commitment to doing it. And I've also been working as a recovery peer support worker in the Trust with Sue and the recovery team in our recovery college. So I work on the meet and greet desk and welcome students who can often be very nervous. And also I co-facilitate some of the courses. And then I say any advice if there's other organisations that wanted to replicate the peer support worker model. We use the Institute of Mental Health for the training. I think it's really important to do training for the role. This is also accredited by the Open University, and it's an 11-day training programme with an assignment at the end. And this was followed by some voluntary and paid employment as well. And yeah, I think in our strategy, the recovery strategy, it's really important that everybody in the trust knows how important the peer support worker role is. So we're doing work, trying to promote that. Because all teams do need to be on board. I'm very, very supported by the mother and baby nursing team. When I come on, they give me a briefing about any new mums or if anyone's particularly unwell, and I feel very supported as well at the end of one of my shifts to be able to talk through anything that might have worried me or anything like that. So I think in relation to nursing with peer support, it's all about, working better together. In peer support we have more time to spend with service users. And yeah, I just wish there had been a peer support worker for me really when I was poorly, because I think, we are very effective.
Thank you very much. I'm really conscious that we've got the next session people entering the room, so that's great. Got double whammy, so you've listened to us as well as the next session. But can I just thank the panel very much for their insight, their expertise and their support for this day, and thank you for coming and listening.